We were speaking about simple SPMS, right? Normally, through that, the line of gravity will be passing, and then it should cross here. In between the thighs, it should be passing like this, right? And at the knee joint, it will passing exactly in between the knee joint, right? Normally speaking, 6 centimeter will be the normal distance between the maximum normal distance between the both between both the knees. Normally for any persons, it can be increased a little bit. It can be reduced a little bit. That is not a problem. But most probably it should not change a lot. 60 to 60 centimeter, that is not right. Right? 6 centimeter instead of 6 centimeter. Whether it is like this, it is also not right. Right? If the distance increases, we call it as Genu Valgum. If the distance is reduced, we call it as Genu Valgum. Right? It will be like this. It will be closed. Both the knees will be locked inside, locked knee. Right? Or else if it is separated, we call it as bow legs. Right? Okay. I'm asking more questions. In between the both the knees and both the legs, the line of gravity is passing exactly at the center. That means there is no problem. Right? It indicates another thing. We were speaking about 6 centimeter between both the knees. That means indirectly it says from the line of gravity towards the tip of the middle tip of one leg. What will be the distance? 3 centimeter. Right? The same in the opposite side also. Right? This is center. So this is center. So there will be distance between the center, line of gravity to the middle tip of the knee joint. That should be 3 centimeter. Now they are not making it the correct position. But anyway, when we are asking the patient, when we are asking the model to keep that right position, normal. Yes. If you are maintaining this position, 3 to 5 will be the normal distance. This indicates the normal posture. Right? Suppose, imagine, the line of gravity is like this. The distance between the line of gravity to one medial part of the knee joint should be 3 to 5 centimeter. Suppose if it is increasing to 10 centimeter, what does it mean? It indicates some problem, right? The same way, the opposite side also. Otherwise, I am asking you in another way. The line of gravity should pass exactly through the center. Both the knees are like this, exactly through the center. Suppose the line of gravity is passing a little bit closer to any one joint. That means also, that is also indicating some pathology. It is not normal, right? Am I right? It's not normal. Just look at him closely. Yes. See? He is bearing weight on this side. He is bearing weight on this side. So the line of gravity will be passing through this very close to the weight-bearing leg. Yes, of course, when we are walking or standing, in which leg we are actually bearing the weight, the line of gravity will be very close to that leg. When we are bearing weight to this leg, the line of gravity will be very close to this. And when we are lifting the opposite leg, the line of gravity will be passing exactly through this. Again, when we are lifting this leg, the line of gravity will be passing through this. And when we are putting weight on this, the line of gravity will be very close. This is normal. So this indicates the person is bearing weight on this leg. This indicates the person is bearing weight on this leg. Right? This is normal during gait process. Suppose always, if they are being like this and the person is not able to bring the line of gravity towards the right, they are struggling like this. See? Okay. He is not able to maintain the line of gravity towards the right. He is trying to maintain, again, due to pain, he is going towards the line of gravity is going towards the left only. Again, he is trying to compensate, but again, he is failing, and the line of gravity is moving towards the left only. Right? What does it indicate? it indicates there is some problem with the left knee. Okay, maybe osteoarthritis. Osteoarthritis. Suppose if you are having any pain in the knee joint, will you walk coolly? Will you walk cool? Right? Will you walk straight like a military man? What do you do? You'll go for antalgic gait, right? You'll struggle to walk. You'll compensate. Your compensation will be from the hip itself. You'll move like this, right? You tend to lean and move like this. You try to reduce the weight bearing towards the painful area, right? That generally this is what will happen. So that indicates maybe, for example, osteoarthritis. Many other conditions, but anyway, for example, osteoarthritis.